Greetings. Today I'll be discussing, can stem cell therapy repair damaged skin, scars, or stretch marks? Skin damage, scars, and stretch marks are common concerns caused by aging, injury, surgery, acne, or rapid weight changes. Because traditional treatments often provide limited results, many people are exploring regenerative options. This leads to an important question. Can stem cell therapy repair damaged skin, scars, or stretch marks? If we haven't met already, I'm the digital avatar of Dr. Max McLeod, also known as the Nutrition Ninja Doc, founder of MyBodySymphony.com and the STEM Region/Age Reversal Technology Center, see ARTC.Health. He is a problem solver with a focus on helping people overcome their health challenges and achieve their health, performance, and appearance goals. He is using this avatar to save time making videos that can be better spent helping people. My role as his avatar is to convey his knowledge and insights about health, healing, and regeneration. Please realize that I'm an avatar of a doctor, and none of what I convey should be considered medical advice. It is for educational and entertainment purposes only. Consult your trusted healthcare provider before making any significant changes to your health regimen. Doc Max also provides individual supervision, in person or virtual. Contact us at 941-806-5511 to learn more. Now let's get back to today's topic. Before that, I ask that you leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way to help get these health-related presentations out to more people. The skin relies on collagen, elastin, and healthy blood flow to remain smooth and resilient. When the skin is injured or stretched beyond its capacity, these structures can break down, resulting in scars or stretch marks. Over time, the skin's ability to repair itself naturally decreases. Stem cell therapy, particularly treatments involving mesenchymal stem cells, MSCs, or stem cell-derived factors, aims to improve the skin's healing environment. These therapies may reduce inflammation in damaged skin, stimulate collagen and elastin production, improve blood circulation, support the regeneration of healthier skin tissue rather than replacing skin overnight. Stem cells help activate the body's natural repair mechanisms. Patients may experience improved skin texture and smoothness, reduce the appearance of scars, fading of stretch marks over time, better skin elasticity and tone. Results are typically gradual and may require multiple sessions depending on severity. Stem cell-based treatments are increasingly used in aesthetic medicine to support acne scar improvement, post-surgical skin healing, skin rejuvenation procedures. They are often combined with microneedling, PRP, or laser treatments for enhanced results. Stem cell therapy cannot completely erase deep scars or stretch marks, especially older ones. Outcomes vary based on skin type, age, and treatment approach. Realistic expectations are essential for patient satisfaction. Stem cell therapy shows promise in supporting skin repair, improving texture, and reducing the visibility of scars and stretch marks. While not a guaranteed cure, it may offer a regenerative option for individuals seeking healthier, more resilient skin. To learn more about whether stem cell therapy might help you, contact us. STEM Region, Age Reversal Technology Center, 941-806-5511. Website ARTC Health.